Hi everyone, welcome back to my channel. In this video, we're going to talk about retrolisthesis and the management of retrolisthesis. It's a very common condition that many people suffer with all around the world. And in this video, one of my online clients, Mohanraj, who was working for the last 6 months with me, going to share with you his experience. Mohanraj had a L5S1 retrolisthesis and also a disc herniation in the same level. Now, he's been working with me for over the last 6 months. He was in a really bad condition when we started him. He was not able to sit comfortable or walk, but now he's back on his foot, back to work. He can go and train in the gym actually right now, and he's in a better space with no pain, no symptoms whatsoever. He's going to share with you how did he end up working with me online, where is he in this stage, and how he found the rehab plan. And also at the end of this video, he's going to share with you his top tips that help him to recover from this condition. Now, you need to understand that retrolisthesis is not something that we fix it, we manage it basically, and we teach our clients how to live with it without any issue. You need to follow a rehab plan that to build up your overall, your whole core and your body, that you're able to do day-to-day activity and lifting and twisting and rotation. Now, if you are suffering from this condition, make sure to watch the video until the end. I also have share with you a link below that is a rehab plan that I have in my YouTube channel that you can use it for free. But however, if you need further assistance, you can always contact me through the link below and you can book an online consultation and we can get you started right away. Let's get started.
Okay, Manoj, I suppose this is our testimonial video today because you reached a milestone that we've been working with each other for a while, and I would love to share your actually results and basically progress with people who's watching this video. I mean, maybe right away you start with what happened, what was your injury, Manoj, and how did you end up contacting me?
Well, first of all, I really wish this video will reach many people and many will get benefit out of this testimonial.
You're very kind. You're very kind. Thank you.
Yeah, actually, my case work, it's almost in the August 2024, if I remember correctly, end of August 2024. I was having a back pain issue. During COVID time, I was working from home. You know, my work style is like, working from home is my routine. I was doing it during COVID time 2.5 years. I was using like normal chair, no ergonomics was followed. This is my opinion that I did something mistake in this side.
Yeah.
So I was having this back pain, followed by I went to consult with one time. In the weekends we used to play cricket. So we normally I go to cricket in the weekend, and one time I was having a back issue. I couldn't knee down and get the ball. I was having severe pain. Then I consulted with the local doctor, and he suggested me I was having he didn't explain me very detailed what exactly my spine. I don't know anything about the anatomy of spine. This is my first time I'm hearing back pain, so I thought muscle pain.
Yes.
And then I consulted the doctor, and he said better go to physiotherapy, followed by my MRI. After all, I was doing the regular things. I don't have any problem. After 2 years, I'm just giving you my whole background.
Which means that was the first time that you got the pain.
That was first time. Yeah. It was 2 years back.
Yes.
So after that, I was doing, the GN wheel, like the big GN wheel in our area. It was there. So one weekend we went with family and we were doing the GN wheel. So followed by that, my pain was terrible. Was increased again to the initial level, more than initial level.
Yes.
I consulted the same hospital, same doctor again.
Yeah.
And he said the same answer, like go for physiotherapy. So the thing is, I didn't get into details like what exactly the problem, why it is giving this pain, and I thought it's something simple muscle pain.
Yeah.
Then next time this problem was severe, I also went to India. I'm basically from South India, so I consulted in a hospital in South India.
Yes.
And they suggested me MRI again.
Yes.
And then followed by the MRI, they said I have the L5S1 disc prolapse was there.
Yeah.
And
Disc
which is
herniation there.
yeah, disc herniation, which is compressing my nerves. This was, they diagnosed and they told me very clearly. Then I just did it. Also another thing, because last August, Bob, I cannot able to walk freely for freely means even not more than 10 minutes.
Yes.
I can walk, but it will be hell lot of pain.
Yes.
I cannot sit for continuously for even 5-10 minutes. This
Got
was
you.
the situation last August.
Yeah.
So
And
I
Manoj,
went to the
when you got that MRI in India, they told you that you had that I suppose this herniation L5S1, and did they explain to you the rest of your MRI, because you had retrolisthesis, you know, in that level as well, which means kind of like a shift of your instability in your lumbar spine, which is wasn't like a severe grade, it was grade 1. Retrolisthesis, and did they explain that to you as well? And what are the precautions that you have to have?
To be honest, no.
Gotcha.
Actually, they only focused on my key problem, like L5S1, or at least you can say the symptoms which I have. I cannot able to walk freely. I cannot able to sit for some time. I explained all the things. They try to check my lifting the leg and how severe my pain. You know, like they asked me, can you hold the bladder? You know, all the basic questions they asked me. Everything was okay. Then they didn't really they go into that other aspects of what you explained just now. They given me only the SNRB. They said a selective nerve root block injection.
Gotcha.
They said this will help me in fixing this. So I just took that one in the back like they gave me some anesthetic, and then they did this injection to the backside where the nerve is compressing. I don't know about detail how it works and all, but they gave me this.
They gave you nerve block, basically.
Yeah, exactly. But still, Bob, my level of pain from 100%, it came reduced to like 20-30% max. That's it.
Yes.
It didn't help me in a holistic way. Yeah.
Yes. Got you. And when was that, Manoj? When was that?
Bob, it was actually last August, September. In that
August, September. Okay.
Yes.
And that was in India, basically, right?
Correct. In the same hospital in South India.
Yeah. Then did they provide you anything to do, like as a rehab or exercise, the routine to follow?
They told me, Bob, not to start any exercise until few months, at least they said. So initially they said only try to be as rest as possible, and you will get better. This is the feedback I received, Bob.
Got you. And what did you do then after that? What did you do?
As like others, I was trying to watch so many videos, so many doctors. The online Leptom, similar things. I try to contact different doctors with my MRI. What do you think? How it can be progressed?
Yes.
So many doctors, if you see, I'm not sure how they interpret my report. Most of them were inclination towards surgery. They said simple surgery. It's like a LASIK one for your eyes. You need just 30 minutes, and you can be free after 2 days. Some are like this statement. They said, and I said, really, 2 days I can be normal? They said it's only minor surgery by.
It's basically micro dissectomy. Yeah, it's considered as a very kind of micro surgery, but that's the opinion that they have. Okay, but that was the suggestion to go for surgery. And then did you consult them in India, or you came back to you in UAE?
No, I'm in Saudi Arabia.
You're Saudi Arabia.
No, I contacted you while I'm in Saudi.
Got you.
Before I contacted you, Bob, as I mentioned, I was trying all the things wherever I can do. I try even to go to the homeopathy kind of like a Siddha one, where you can do the I don't know how to explain, but they have their own protocol how this can be cured. But unfortunately, I don't have that many days of leave, and my body condition was very bad. So and I don't want to mix between SNRB and the English medicine versus Ayurvedic. I don't want to mix both. This is my plan.
Yes.
Follow one, and whatever the result, then go to next. This is my
Got you.
opinion. Even
Got
I
you.
believe this is best for all. My experience also. So I follow English. Let me follow English medicine and things.
Yes.
If not working, then I
Got
jump
you.
into other. The
Yeah.
time, Bob, my one of my colleague in my office, he suggested me. He had 2 surgeries also in his back. He's from Jordan, basically.
Yeah.
He suggested me KKT technology. KKT, they said it's kind of non-invasive, no surgery, nothing, no tablet.
Yeah.
So they said he got really a good recovery out of that. So he suggested me go for KKT.
Got you.
I found one in Bahrain near to me. So I just went there and I followed almost 12 sessions. I followed there before I contact you.
Yes.
How I can say, like, it was kind of pain relief. Yeah, I don't deny that. I got better management in my pain.
Mm-hmm.
I can able to sit for 20 minutes like that. But it's not really, I feel like as a solution for my problem, like
Got you.
not as a rehabilitation or not as
Mhm.
my long-term solution. So
Got
I
you.
was again, I'm not happy and was searching. I tried until then I found many testimonials
Mhm.
from your video. I searched, YouTube search, and then I found your video, and this is how I tried to book an appointment with you.
Yes.
Even after the appointment, you suggested me to take a plan. I didn't go in straight. I was having again double thoughts. Should I
Yes.
continue with a KKT or should I skip on KKT and go back with you? I mean,
Got you.
I want to
Got you.
stick
Yeah.
with one plan, trust
Of
one
course.
person.
Yeah. Maybe describe, Monraj, how was the initial consultation that we had? Because like in the initial consultation, we covered a lot of questions, etc. How was it in your own opinion? Like, how did you find the initial consultation?
Actually, you were very promising, Bob. To be honest, still I remember I was in bed at that time. When I was calling you. I make a
Mhm.
setup in a way that I can work from lying down position.
Mhm.
I bought some extra accessories which can support me not to sit too much time in the sitting
Yes.
posture.
Yeah.
So that was my initial call with you.
Yeah, because you weren't able to sit much actually, right?
No, yeah, I was in
Exactly.
you. Even I remember you said, "Don't worry, just be relaxed
Be
with the lying
comfortable.
position."
Yeah.
Yeah,
Like literally the first call that we had, you were in the bed and you were lying on your back. You weren't
correct.
comfortable. And what was the symptoms in that time, Monraj? Maybe you tell people what was the symptoms in that call when we had
Yes,
in that period
actually,
of time.
the main symptom was, Bob, the numbness.
Yeah.
The numbness was too high,
Yeah.
and I feel like it's like a panic situation because I read so many articles about
Yeah.
this problem, so many videos. So I get to have like, okay, if I get this numbness, will it affect my nerve too much? There was too much pressure in me, like how it will affect my,
Yes.
the other nervous system and things like
Yes.
that.
Yes.
So I was too much panic, and numbness was there, leg pain was there. It was leg pain means near to my thighs and glute. That
Yes.
area was too much pain. So
Got you.
every day I try to wake up and see how much I'm getting pain. Is it too
Yes.
much or is it medium?
Yes.
This was my
Yeah, and technically speaking, that was the pain and I suppose symptoms that you had. How much was your activity in that time? Like, what you able to do?
literally nothing, Bob. I didn't lift anything. Even I followed some physiotherapist in India before I
Yeah,
approached you.
yeah,
The recommendation from that physiotherapist was don't strain yourself, just try to be in lying position. I was like pregnant women, the care how they try to give, I was like giving the care as much because my wife also focusing on me, and
yeah.
everyone was focusing me like in the final month of delivery, how they will give a care, extra care. They were giving me as much as possible from their side and from my side also. I was not
Yeah.
lifting my kid. I was not even lifting my laptop. Imagine that much of
Oh my God.
careness they given.
Yeah, yeah. Okay. And technically, you got an injection that helped a little bit, but it wasn't obviously the symptoms didn't go away. You were still
No,
struggling. You got that other treatment that you say and
KKT, yeah.
it didn't really help. And then we discussed your basically case in the initial consultation. And what was your intake out of the consultation? Did you find your your question were answered in the initial consultation?
Definitely yes, Bob. Definitely yes. I can say you were like very positive. First of all, still you remember. I remember that you said, "Let's make a testimonial of yours."
Yeah, and it's happening now. That's solid.
Really, Bob. Really,
I'm
it's
delighted
really.
with that because I did mention that, and you remind me right now because I told you possibly, Manraj, in 5-6 months' time, we record your testimonial and share your results with people, right? And that's happening right now.
That's
and
happening.
I'm delighted, man. I'm delighted because, man, you're a totally different person because, first of all, you are sitting now in a chair comfortable.
Yes.
We already started your gym routine. Not only that your symptoms improve, you're actually in the gym, training in the gym. I know the training intensity is not as intense that you wish, to reach to, but that's just a matter of time. You're gradually going to build them up. But the fact is that you're part of the community outside of the house. You can walk and go to the gym and go back to work, etc. But okay, that was the initial consultation. And maybe just to start with people, like how was the start of the plan? How did you find the plan actually when we start your plan?
Bob, even to be quite honest, some of the okay, I will just give the rest of people who are, because I was watching at least more than 50 videos during my more than 50. I'm saying, even including your testimonials, many people's testimonials. So I really wish this audio and this video will helpful for them in multiple ways. I try to be for them, not for the definitely.
Absolutely. So, absolutely. Add on as much as you can. Yeah. That's totally up to you, man. Keep going.
Yeah. So yeah, basically I was having the tendency that because most of your basic exercise you provide me, initially you told me like your problem is this, whatever you explained in a medical term or by an anatomical term. For me, disc herniation is easy term, which is very clear, but other terms I'm not very sure. Anyhow, so the thing you have given me a kind of schedule, like weekly schedule. I have to follow day 1, day 2, day 3, the exercises.
Yes.
You have started with still I remember with the 3 exercise of stretching exercises and the other strengthening exercise.
Yeah.
So it was repetitions and everything was detailed in that, and you given also video links for each exercise, and you are available in WhatsApp, which is useful, honestly.
Yes.
So the point is, what I mentioned, like I didn't trust you even initial, even after I took the plan, I was not really 100% because some of the exercise like cat camel. Can I able to do it? Is it okay?
Yes.
I was having
I remember that.
in my mind.
Yeah. You had so much fear of movement.
Yes,
fear you were asking me, and I remember that, Manraj, and that's good that you talk about this because some of the exercise that we start you was in your mind was difficult. Should I do them or not? Are they safe for me to do them? And that's good that you're talking about this. Keep going. That's very good.
Yeah, because as I mentioned, this is for the rest of people who are suffering,
absolutely,
like me in the past. So, the fear of movement, very very important point. I even didn't trust that, but when I was doing the cat camel, even I saw comments. Many commented, "Is it really for back pain issue?" I was even reading that, and I was asking my wife, "Is it really good? I can do this." I didn't do, honestly. Even you are laughing, right? I didn't do first time. First 1 week I didn't do. I'm not really fully trusting that. Then he said, "Monraj, try. It will be fine." Then I follow you. Bob, really, it was very good. The first 2 weeks I was having like massive pain, but followed by it was gradually reduced. And to be honest, I was fully trusting you. As I mentioned, I'm following one plan means I will trust them, because if you're not trusting,
100%.
jumping here and there, it's not going to help. I trust you. I stopped the KKT. Yeah. And everything else.
That's a very important point that you mentioned, that I definitely suggest my people that listen to your gut and go with your gut. If this is not something for you to do, I do not promise you anything magical on the first day of our call. I do not promise any person that we're gonna basically fix you. You know, there's no such thing. I believe that people can get better if they have a plan. And I believe in human body has ability to adapt and get stronger and build and repair. As simple as that. And did we fix your problem? We didn't fix your problem. We improved your symptoms. We helped you to build up more capacity. And where you're at right now, you're a different person with no symptoms and you're active. Does that make sense? Now keep going,
Yes.
Manoj. That's very good. Keep going. And what happened after that?
Yeah, I mean, I was following the diet plan. You were asking me to have more protein, and you even given me veg diet and non-vegetarian diet.
Mm-hmm.
And then I was following all the regular routine as like
Mm-hmm.
simply trusting you and following, day one, day two, day three, whatever I have to do, I will do.
Yeah.
So you given me, I remember, Bob, weekly 3 days of strengthening exercise.
Mm-hmm.
Every day, 2 times of stretching exercise.
Mm-hmm.
So 3 plus, I think initially it was like 5 strengthening. So around 8 exercise I started with.
Yeah.
Every time 2 weeks once we used to meet, and then you add on and you ask me how I'm progressing. Am I getting pain? Where
Yes.
it is exactly? Monitor it, in that
The
shared
data
Excel
that we
sheet.
collect, the data that we collect through the sheet and
Yes.
and the reviews. How was that for you, Manoj? Because sometimes people think that Bob has some magical plan that he has fixed people. You know what I mean? Like, just maybe describe for people, how do we measure things? How do we analyze the cases? Because if you can't do some exercise, how would I know that you can't do it? If you have pain some days and some days you don't have pain, how can I understand that? It's all about based on that data that we collect. And for somebody like you who had so much severity in their first day of call, you weren't able to speak, you weren't able to walk. I need to know all of those bits and pieces to be able to provide you feedback. Am I right?
Yes.
Which means
Yes,
without those data, I won't be able to give you any feedback. Very simple.
Yeah. Yeah, it was actually the Excel sheet with the shared Excel sheet was having questions like weekly.
Yes.
You have to update it daily basis.
Yep.
Where exactly your pain? What is your stress level? Are you having
Exactly.
numbness, tingling, sensation?
Exactly.
All those questions were there, and I used to update every day. And then
Exactly.
end of that 2 weeks once we used to meet, and that time we will discuss everything.
Yes.
In between, I used to catch you any questions in WhatsApp. This was my, the program all
Exactly.
about.
Which means we basically, besides that, we had every second week call. You had a chance
Yeah.
to ask me questions through the WhatsApp, etc. Then, Maraj, I suppose you discussed about diet, and we discussed about, like, I suppose, the program. What did you find different from this program and other things that you so far you followed?
To be honest, I was even thinking like it is so simple from your program, Bob.
Thank you.
It was only exercise, all about proper exercise for my problem.
Yes.
Like unlike doing Ayurvedic massage, I didn't try. I don't want to comment honestly.
Yep.
But I tried KKT and other different plans. Even I was having that question whether this will solve my problem, because you are giving me only basic exercise. Will it solve my problem? This question I always have, human tendency, right? I cannot 100% trust, the plan.
Yes.
So I was having this question every time, but it is simple exercises, but with the proper plan and proper structure, and it really did wonder to me, honestly. So sometimes simple
but
thing.
that's exactly no, Maroj. That's exactly the key factor about healthcare. Is healthcare supposed to be simple and basic, because we cannot create something complex and people follow that. Do you understand that? That's the biggest problem we have right now in healthcare. Healthcare creates a lot of diagnosis and complexity in here, which means you become confused about even understanding your issue. Beyond that, they give you so many different options to follow. I'm not blaming anybody here. anybody in the healthcare. I'm talking about the system. The system has to change and create people simplicity steps that they can follow, which means you have a routine that you can follow in a day-to-day basis, and you understand that routine, you can measure that routine, and it's attainable for you, which means you can follow that routine in a day-to-day basis. It is not like 6 hours of exercise that you have to do with so many different type of equipment. You're in your own house, 20 minutes of exercises, and they're reasonably understandable for you, and you can follow them consistently. And there's the person who follow and have a follow-up with you and monitor your progress and coach you. As simple as that. And we are not only focusing on just your pain and your back, we actually training your whole body. As you mentioned, it's a very basic routine, very basic exercises, but if you follow them, you get results. What is the result is that you are a fitter person with less symptoms than where we start you, and you have much more independency in your life right now, which means how many sessions of treatment did you got from anybody since you start your rehab plan?
Yeah, I mean, again, Bob, how many?
Like how many treatment did you got from any chiropractor or any massage therapist or whoever since we start this plan?
Actually, not many. To be honest, the India I followed physiotherapist.
No.
And then
not before we start the plan. Since we start this plan, did you got any treatment, Monraj?
No.
Exactly.
No medicine, no treatment.
Yeah, what I'm trying to explain is that since we start this plan, you have done a lot of things with your own body without anybody touching you or manipulating your back or doing anything, which means self-independency. You are in control of your health. Does that make sense? And the only things that you get from my side is that guidance. As simple as that. Does it make sense?
Yes. Actually, that guidance is the correct one. I was really looking for some mentor who can help me out, and just to give you about exercise, because some can do these things in home also. I just want to for others.
Of course.
I'm sharing my experience.
Of course.
Because I was following the videos before I did the MRI in India. I was doing here, some checks with some hospitals and doctors here. I thought, the YouTube videos based on my problem L5S1, if you type it, they give you exercise.
Yes.
Sometimes it is not really meant for you. From my experience, I did some exercise. Still now I'm looking that whether you will recommend, I'm already completed my 20 weeks plan and I'm started another plan with you.
Yes.
I'm still seeing my every week, whether you will recommend that exercise or not. Still now you didn't recommend that exercise, by the way. It's kind of compression, putting your right leg to left and left to right and pushing towards your back. So I used to see it as a basic exercise from many YouTube videos. I tried that. I think I make too much inflammation to my nerves. I'm thinking that because after did that exercise, too much pain in me. Then only I took emergency leave to India and consulted.
But that's a very valid point, man. Thank you for sharing that, because I share a lot of video for people on YouTube and as example for X and Y condition. But my message that I give to all of them, and thanks to you talking about it, is that not everybody can follow that. Every person has a different condition, different injury, and different needs. And if you want to try it, that's totally up to you. But sometimes that usually can aggravate the symptoms. You're definitely right.
Yes. The aggravation
the plan has to be customized, right?
Yes, definitely.
Absolutely. You're 100%. Keep going, Monraj. What else did you find, I suppose, like in regards to the rehab plan that was important for you?
Actually, that plan, even I was doing all those plans, as I mentioned, I trust fully and I follow blindly every exercise and then repetitions. Even I did initially more repetitions in confusion, if you remember that.
Yes.
Then, you said even your body is more capable. That's a good sign. Because I can do more repetitions and
absolutely
simply followed by couple of weeks, I can see my progress. The numbness was coming down.
Yes.
My tingling sensation was coming down. I can sit some time. You know,
Yes.
all are like motivated me even to do more, you know, follow with you more. When you see
Amazing.
the results, you know, it keeps attaching to that plan, you know.
Of
So
course,
I
man.
was
Yeah,
following.
which means your data that we were collecting regards to symptoms showed
Yes,
you that actually you are progressing. I'm not telling
yes,
you that you're progressing. You see that you can progress and you
correct,
can do
correct.
more activity. You can walk more. You can sit longer. You've gone back to work in the office. You know what I mean? All of those factors are reassurance for you, and that build your confidence and shows you that actually I'm getting better. You know what I mean? And we
Mm.
also take care of your diet. You eat well. You take care of yourself. You sleep better. All of that factors. Does that make sense?
Yeah.
Maraj, I can talk about this forever. You know what I mean? And I'm really appreciating that you're actually putting time and you sharing every bits and pieces that was important for you. Few things that I wanted to maybe ask you. One important thing that I ask all of my patients that I want them to share depends on their injury. If you were going to share your top tips that help you in regards to your recovery so far, okay? Because we are gonna share how's your symptoms like right now. Maybe you discussed about how is your symptoms right now after 20 weeks of rehab plan, Monraj? Like where you at right
Um,
now?
Even for me, my symptoms were almost gone in, you know, like tingling and everything.
Numbness?
Some weak, yeah, numbness. You can say standing time pain or glute pain. I can say it was almost. I came back to normal almost few weeks back. Not even 20 weeks of rehab.
Of
To
course,
be
of
honest with
course,
you. But in this 20, you know, even I took another plan with you because I
of
want to
course,
be following this as a, you know, I want mentor. I want a mentor who can see my progress, who can guide my questions, who
of
can
course,
answer
man.
me.
Of
And
course,
I
man.
want to be like complete, you know, recovery, not only pain free, which you
Of
always
course.
mentioned
Yeah,
that.
yeah, yeah, yeah.
So now
The
I,
goal is not
yeah,
to be pain free. The goal is to get fit, get strong, get healthy. That's so important. You're definitely right.
yeah. So I was, you know, now I'm completely back to normal. I can lift the weight. Of course, I'm not lifting more than like 12 kgs so far.
Yes, yes,
That is still I'm cautious. And you
of course.
mentioned it will
Yes.
gradually you will build.
Build
So you
up.
mentioned
Yes,
that.
yes,
But rest everything like kneeling down. Also, I'm doing that exercise. You know, in our plan, I'm trying
yes.
that you know 8 repetitions of that kneeling down exercise, and things were helping me. So sometimes earlier, my back was like you know fragile like straight. You know,
Yes.
it's like a brittle material. My back
Yeah.
was not flexible, elastic material. My
Yeah.
back is
Yeah.
like this.
You were very
So
protective. Yes.
very protective. Very protective
Yes.
means very.
Yes.
So I make myself relax. You know, I can do this. I can
You can
sit like
sit
this.
comfortable. And
Yeah.
that's, you remember one of the very, very early questions that I told you to start to sit, relax. Don't tense
Yes.
yourself. Don't sit upright and don't brace when you're
Correct.
sitting. And that's one of the biggest problems that I see with most of my patients with chronic back pain is that they're all too much protection around the spine and they just like sitting like being at the edge of the table. And I ask them to actually, can you relax? And they don't understand even relax what it means. Now, look at you how you see it, and I'm proud of that because man, that's a lot of work to get to that position and be able to trust yourself again, right?
Yeah, yeah, definitely,
That's
bro.
amazing.
That
That's
you know
amazing.
that comes with the pain-free. Believe me, even I was in the back position as well in the past, and
Yes,
now I can say confidently,
yes,
like
yes.
when you are in pain, Bob, you cannot really do anything
Of course,
within
man.
you.
I can understand
So
that. Yes,
after pain-free, you know, all these things coming naturally. You
yes.
will back to your old life, you know.
Of course, of
So
course. Yeah, 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 yeah. But that's amazing, man. That's the value of, health. Because if you're not able to become yourself and live comfortable, what is the purpose? All
yeah,
right. In regards to like tips, Maraj, I wanted to share your top tips with people who are suffering from disc herniation, retrolisthesis. Retrolisthesis is a condition that is an instability in your lumbar spine, and there are different grades that can be from grade 1 to grade 4, and that can be creating severe symptoms like what you had: numbness, burning sensation, a tingling sensation, severe pain, and people who suffer from this condition can freak out a lot by the name of it and the look of the MRI picture that they see. What would be your top tips for people who are suffering from this condition? You know, because you have done so many things, right? I want to know what would you suggest them to follow?
Yeah, definitely, Bob. This one, from my experience, whatever I did a mistake or my experience I'm sharing.
Yeah, maybe make it like a number 1 to 5 or whatever number. I don't mind. Just make a number.
Okay, in
That
terms of number means
yeah.
number one, just don't follow any advice like the doctor may say go for surgery. It will be simple. It will be 30-minute surgery, 15-minute surgery. Don't do
jump to decision.
unless don't take a prejudgment. You can do more. Still, I remember my practo call with the doctor, online call.
Yes.
I was calling multiple doctors because, it is easy to reach multiple opinion, right? Practo means it's online platform. So I can reach many doctors, different phases.
100%.
Everybody said it's simple exercise. You need to do major surgery. So don't follow that. Don't follow that advice. Try to do 1, 2, 3. If you cannot able to meet anything else solving your problem, then last option is surgery. Don't go for it. Number 2,
absolutely,
try to do like exercise and things in YouTube. Don't follow blindly. Take it as your reference, but always consult with your the doctor or physiotherapist who is capable to answer your problem and compare with your problem. So don't follow anything blindly. And great. Third one, don't consider your patient. You are done. Don't consider this because this will be in your mind. You will be like, you consider like you are 100 or 90 plus age. Don't consider that. You can get back and you can recover as quick as possible. So follow someone like Bob or whoever you feel better in your area. But I did Bob for online, so it is easy for me and it's really helpful. I can catch Bob and do the things whatever beneficial for my back issue. So I'm not saying Bob as alone or one person, but follow the good physiotherapist and do the things. Fourth one, I would say the good food also. This is what Bob used to recommend me. Good protein intake and things helps me to be energized. And exercise, glute, Bob, I think I'm using those things. Strengthen your glutes, strengthen your back, strengthen your stomach. Those things Bob always used to tell me. So try to follow this. But this fifth one, you have to follow some good mentor or good doctor and good physiotherapist. Don't follow yourself. It can go wrong.
Yeah. Yes, that's very good. That's very good, man. That's perfect, Manraj, because I think those are very valuable.
Also, Bob, they should not lift weight. This is my opinion. Lifting kids, lifting cylinder, LPG cylinder or something, lifting 20 kg, I'm fine. It's okay. Nothing will happen.
Yeah.
Don't do it.
No, when you're injured, definitely you don't want to do random stuff, especially lifting something heavy and annoy things, obviously, but you can gradually build them up and get them to that level. And we are doing that right now. Manraj, I really appreciate your time, man. I believe this video teaches a lot of good tips and discussion to people who suffer from similar injuries. And I really appreciate your time, man. Thank you for trusting your plan and sticking to the plan, man. That's a lot of, I suppose, time. And one other thing that I'm going to add on top of all of these, that nothing good come quick in regards to the rehab. I work with so many people online, and as you can see, all of these testimonial video that people see on YouTube, they're not overnight achievements. And whoever promised you overnight achievements, I would doubt it, because I'm still searching for it. You know what I mean? There's no such thing.
I understand.
Health is not a quick thing to achieve. Health is a culture. You want to build up that culture around your life and teach that to your friends and family and your kids. And I'm really valuing that and practicing that. I'm preaching it in a day-to-day activity that I have with myself, my wife, my kids, and friends, because you can get better by having a plan. And if you follow it, you will see results. And I'm delighted to see you, man. And now we are in the gym. We're training you gradually in the gym. I'm going to share some of those videos that you're in the gym with people. And I'm really excited for your progress, man. Well done.
Thank you, Bob. Thanks for all your support and mentorship. And yeah, thanks, Bob.
No worries, no worries. Listen, thanks again for your time, and we'll catch up maybe in another time to share more progress, Manoj. Cheers, man.
Sure, Bob. Sure, definitely. Cheers. Bye.
Cheers.
Thank you for watching this video. I hope you guys find this video helpful. If you are suffering from retrolisthesis, you need to understand that retrolisthesis is not a condition that you can fix it overnight. We do not aim to fix it. We're managing it, and if you need help with the management of this condition, you can always contact me through my website or book an online consultation with the link below, and we can get you started right away. If you find this video helpful, make sure to subscribe my channel for my weekly update, like and share this video with your friend and family who may need this information. Until next week, all the best.